everybody, and welcome to the new time for our live stream. I thought we would do better when we did live on Tuesday nights. So you let me know what you think. If anybody's here watching, as always, I love to know that you're here by a thumbs up button. That will be great for me. And of course, if there's any comments or questions, that's the beauty of the live stream, is I get to answer your questions live. So I'm so excited to be doing this. I hope that that this is a good one, a good time for you, and that you can join me. I'm trying to make sure that I am here on the live stream with you, and that's what we're doing now. And for some reason, this seems to give me a hard time every single time, but I am going to try and join. Hold on for 1 second. And that's why I do this a few minutes early, so that we can here we go. And now I'm going to be with you live. Yay! So as we're going to start in just a minute, but as always, I like to start a little early to make sure I'm all set up, and also to give a special shout out to my favorites, my patients at Mass General. If you're here with me tonight, hello. Anybody from MathWorks, hello. And anybody from my private practice. For those who you're new, I'm so excited to have you join. I'm hoping that Tuesday is a better time than Sunday night was. And we are going to start, I like to start exactly at 7:30. So that's what we're going to do, which will be 1 minute. Here we go. So many people don't give any thought to particular vitamins, in particular vitamin B12. And the question is, do you need to take this in the form of a supplement, or are you okay to get this from food? And either way, why is it important? And why should you be worried about it or concerned, or why should you give it any thought? What makes me an authority or in a position to be able to discuss this with you? For those of you who are new to my channel, let me introduce myself. Welcome, first of all. I'm delighted that you're here. And if you are, definitely hit the thumbs up button. That lets me know that you're here. And if you have any questions or comments during the live stream, the beauty is that it will come up on my screen and I'll be able to answer you live. And you can ask questions about B12 or anything in terms of nutrition. I'm happy to address the questions. Also, if there are any topics that you'd like me to cover in upcoming segments, let me know that as well by writing that in the bar. And please, if you like this, please hit the subscribe button, because that will let me to continue to do this with you, and so I don't get eaten up by YouTube. So welcome. My name is Debbie Kravitsky. I'm a registered dietitian. I've been a registered dietitian for over 30 years. Currently, I'm the director of nutrition at Mass General Hospital's Cardiovascular Disease Prevention Center. I consult for many corporations. I've appeared on television, and I've also been featured in national publications such as Harper's Bazaar and Family Circle. It gives me great pleasure and joy to provide current, accurate, evidence-based nutrition information to you to help you to reach your dietary goals. Together, we will shop, we will cook, and I will navigate the way. So, let's get started. Vitamin B12. It's an important vitamin, and we need it for many things. We need it for the formation of red blood cells. We need it for neurological function, and we need it for DNA synthesis. That's your genetic code, and you want that to go correctly. So you need B12 for that process to happen. It's also involved in many key enzymatic reactions, which will help you to maintain good health. So how do you know if you're deficient in vitamin B12? Well, let's look at the signs. 1, fatigue. You've had 8 hours of sleep, and yet you wake up and you are exhausted. This could be a sign of a vitamin B12 deficiency. Your muscles feel like mush. You go to lift something, you know it's not heavy, yet to you it feels like it weighs a ton. Without B12 delivering oxygen to your cells, you might be weak. You might be out of energy. It might be that you feel like pins and needles are at the end of your fingertips. You feel like pins and needles because you could have nerve damage as a result of a B12 deficiency. All of a sudden, your food doesn't taste very good. Actually, it tastes blah. If you look at your tongue, you have these little bumps. They're called papillae. They're your taste centers. And with a B12 deficiency in some people, you're going to see, instead of the bumps, you're going to see a smooth red tongue, and often it's smooth and it's red. Some people will complain of burning or pain around the sides or the back of their tongue, and this could be a sign of a B12 deficiency. You cry at every little thing. Commercials. This could be a sign of a B12 deficiency. You walk into a room and you can't remember why you're there or what you're getting. You also feel a little wobbly or unsteady. Am I hitting almost everybody out here? Because these are the far-reaching effects of B12 deficiency. In some people, in extreme cases of a B12 deficiency, you will see that it can cause damage to the optic nerve. So some people see double vision, some people have loss of vision, and burning or pain in the eyes. This also could be a sign of a B12 deficiency. So where do we get it? Well, when we get it from food, we get it from protein foods, from meat, which includes fish and chicken and turkey and eggs, and also dairy foods, cheese, yogurt, milk. And in these foods, it comes very tightly bound to the protein in those foods. It requires acid in your stomach to pull that B12 apart from that protein, so now it can go on and be digested and utilized by the body. Now, over the age of 50, if any of you are out there who are listening who are over the age of 50, definitely give me a thumbs up. Let me know. Because over the age of 50, we don't make enough acid to pull that B12 apart from the foods that you're eating. There also will be, so you could eat all the food you want, all the protein you want, all the dairy foods you want, and you're not going to be able to get that B12 apart from the protein because there's not enough acid in your stomach to do it. So you're not going to be able to utilize the B12, and you're at risk for a B12 deficiency. So for you, the food isn't going to do it. For those over the age of 50, you need to take the supplement. Anybody out there who's diabetic, who takes metformin, metformin interferes with the absorption of B12. You need a B12 supplement. Again, food isn't going to do it. You need a supplement. Anybody out there who are heart patients, who take calcium channel blockers, beta blockers, this will also interfere with the absorption of B12, and you as well, no matter what your age, needs a B12 deficiency. So, which B12 should you get? They're not all created equally. If you go to your local drugstore and you get Nature's Made, Nature's Bounty, it comes in a form called cyanocobalamin. Cyano is just what you might be thinking it is, cyanide, because there's a little bit of cyanide attached to this B12. This cyanocobalamin, cobalamin is the chemical term for the word B12, that this is made in the lab. It's the cheapest form of B12 because they can synthesize it. The amount of cyanide in this supplement is thought to be so small that it wouldn't do you any harm, unless, of course, you have a sensitivity to cyanide. And how would you know? The only way you're going to know is exposure. So, it's thought that it's an easy, readily absorbed form. The amount of cyanide is so small it shouldn't make a difference, and you're more than welcome to get that kind of B12. If not, I also prefer, actually, methylcobalamin. Methylcobalamin is the active form of B12, the form that circulates in the blood. How much do you need? It depends upon your age. For kids up to the age of 5 who are on some of these medications, then you need 5 micrograms every day. For teenagers, same thing. If you're on these medicines and you need to, or you're not eating protein foods and you're a picky eater, you also need 10 micrograms per day. For adults up to the age of 50, 100 micrograms per day. And once you get over 50, you don't make the acid, so that you need to up your intake to 250 micrograms per day. Over the age of 75, 500 micrograms per day, and vary the dose by checking the labels. If you have any questions or comments, definitely write them in, because I'm checking. I'm looking for you guys. And let me know that you're here by hitting the thumbs up button. Always verify your dose by checking the label and by checking your serum B12. If you have any comments, let me know. Am I going too fast? Is this helpful for you? Is this good information? If you have any comments, I'm loving to, I don't see it. If I'm in any comments, I'd love to see it. What? 1 minute. I'm hearing that I have comments, and I'm so excited. Say it out loud.
Lorraine says hi.
What?
Lorraine says hi.
Oh, hi Lorraine. I'm so excited that you're here. I'm hoping this is a better night for you, because I know that Sunday night wasn't a good night. So, oh, here you are, Lorraine. I see you. I'm so happy that you're here. Let me know if this information is helpful for you, and if you should have any questions. Now, vitamin B12 is a water-soluble vitamin. That means if you take too much, you're just going to pee it out. You're going to have expensive urine. It's hard to go too high. Always check to see what your blood level is of B12, to know where you're at, to know if the supplement is doing its thing and correcting. But understand that not all labs use the same guidelines. And so here are the guidelines for you. And you can contact me, or the beauty of the live stream is you also can play this over and over again, so you can hear this information, and you can pause it in replay so that you can write down any notes that you need to. But the serum level should be, make sure that your lab is using the appropriate, or make sure when you look at your serum level of B12 that this is the guide you want. You want it to be at least 300. It comes in picomoles per liter, and even 400 picomoles per liter. If your serum level is less than that, you could be deficient. Now, that just measures the amount of B12 in your blood or serum. You can have a lot of B12 in your blood, but it's not being used by the body. There's a difference between abundance and actualization. So check for what we call metabolites, or byproducts of B12, when we use them in different reactions in your body. And one of those is called holotranscobalamin. It's and you're looking for greater than 50 would indicate greater than 50 picomoles per liter would indicate deficiency. Something else called methylmalonic acid, MMA. If it's greater than 271 picomoles per liter, you could also be B12 deficient. These are signs of a B12 deficiency. This MMA, you test it in your urine, but if you have kidney disease, this won't be a good test for you. Look for the holotranscobalamin, compare it with your serum. If they're both levels are off, then you have a B12 deficiency and you need to take it. Now, this one here I got at Whole Foods. This is the Jarrow brand. This is in the methylcobalamin form. It's 1,000 milligrams. It's a little more than I like. I think almost everybody could take 500 micrograms. You're only, of the 500 micrograms, you're only going to absorb 10. You won't absorb a lot of this. It's limited by something called intrinsic factor, which is secreted by by cells that line your stomach, called parietal cells. So you're not going to absorb a lot of this. In my Whole Foods, they only had the 1,000 micrograms, but I'm going to be fine because it's a water-soluble vitamin, and it will certainly meet my needs, probably more than meet my needs. So some experts recommend that 50 to 75-year-olds should be at 250 micrograms, but even at the 1,000, you'd be totally fine. So go into the store and see what they have in your local store, and then you'll get what's appropriate. Now, you also can order these online. Amazon has this Jarrow in 500 micrograms, and that would certainly do the trick for you. Some doctors find that when their patients are deficient in vitamin B12, they give them what's called intramuscular injections. Keep in mind that both the oral supplement and the intramuscular injection are both equally effective in correcting a B12 deficiency. With the intramuscular injections, there sometimes can be mood swings. So somebody gets their injection of B12, they feel euphoric because this is involved in red blood cells. This is involved in the delivery of oxygen to your cells. So when they get the boost, they feel energized. When they get low, when they're waiting for the next injection, then they're feeling a little down in the dumps. Oh, I'm so glad, Jim, that you're on the live stream and that you figured it out. And I'm hoping tonight, Tuesday, it looks like it's a better night for everybody. Now, why are some brands of B12 cheap and others more expensive? Great question, Lorraine. It has to do with the form of B12 that they use. So the cyanocobalamin, they make it in the lab. It's synthesized by man. It's inexpensive. It's cheap. This methylcobalamin will be a much more expensive form because this requires the activated form, the active form that's found in your body. So it does make a difference, I think, in which form that you get. You also can get, Whole Foods has a form of, theirs is called, let me find out. Their B12 is called, I think it's called Simply Life, and their B12 form is in the form of a dropper, and it's in the form of cyanocobalamin. Now, their dropper is called My Kind, and their dropper, many people complain that the dropper breaks and that it has a kind of a funny aftertaste. So I just attuned to take the supplement. Online, there are many good brands from Life Extension to Jarrow to many. And look at the customer reviews. They'll let you know what they think, but look for this methylcobalamin. The other active form of B12 is called adenylcobalamin. So sometimes you'll see a combination of both, but that's usually in a higher dose. Vegan Safe is one that has a combination of both, but it's 2,500 micrograms of B12. I just don't think you need that much. I don't think it'll hurt you. I just don't think you need that much. But always check your serum and then check your serum again after you've been taking it for a while. And that will let you know how that supplement is, what it's doing for you and how your body's reacting. I'm loving seeing you guys here. This is just awesome. Awesome. Any other questions? Have I answered questions? Let me know. Has this been helpful for you? Has this been informative? Because many people don't think about taking a B12 supplement. They don't, it's just not on their radar as to whether or not you should or not. But keep in mind, it'll make a big difference. You will feel the difference. You will feel more energized and you will feel stronger. And it's also involved in mood regulation. It has to do with the production of serotonin and dopamine, so it will help you to feel happier, more stable. And so it has far-reaching effects that you might not have given thought to previously. So I'm going to stay on for just a minute or two more. If you have any questions, or you can let me know if this is helpful, I'd so appreciate it. But in a few minutes, I will sign off because I think I've shared everything you need to know when it comes to B12. And if you have any questions, let me know. You always can always reach me on Dishing with the Dietitian. If there's anything else that you want me to cover, definitely let me know. And absolutely, please, I so appreciate it if you hit that red subscribe button. And what I mean by this allows you to stay on YouTube is that when you put in vitamin B12, you're going to get people who have many, many more subscribers, and by me upping my number of subscribers, it will help me to get to be more recognized on YouTube. And Lorraine, awesome. Yes, this is great. My husband has been asking if there's any way to check your serum levels, or if you have to ask your doctor. You have to ask your doctor. Now, for him to check both your serum as well as check that MMA, the holotranscobalamin, or something else called homocysteine. I would like to take it as a prescription. It is not. It is over the counter. So this methylcobalamin, it is over the counter. So you don't need a prescription for B12. You can just take it. I have been buying the cheaper. The method is better. Buying the cheaper, the method is better. Either way is fine. I just like to get the active form without having cyanide in my system, even though it's small and they say it's not an amount that you need to be concerned about. Hi, Sue. I'm so happy you're here. And methylcobalamin, yes, and it's spelled METHYL. Cobalamin is the form for B12, and it's because B12, it's the only vitamin that has a metal ring to it, and that's a cobalt ring in the center of its molecule. And since it's a cobalt ring, it's called cobalamin. And that's why we call vitamin B12, its scientific name is cobalamin. You're welcome, Jim. I'm so happy you're here. I'm so excited that you figured it out. You guys are just totally the best. If this has been helpful, your comments have been fabulous. Your questions have been amazing. Definitely hit the, oh, you're welcome, Lorraine. You're just amazing. I can't even tell you how much I love having you here and how much I so appreciate it. Definitely, if you haven't subscribed, do so. And if you can hit the thumbs up button if this has been helpful, that is also great. I so loved having you here on Dishing with the Dietitian. In 2 weeks, we would have been doing another live stream at 7:30, but I will be at a conference in DC, so we will not. We will do so the following week on October 30th, and my plan is to show you how to have a happy, healthy Halloween. Thank you, Susan. I'm so glad you've loved this. You're great, and absolutely go Red Sox. They're playing today, and they start at 8, so I'm going to get off in time for you to be able to watch the game. That was quite a showing last night, so great. Everybody have a happy, healthy series for baseball and happy, healthy times. Here's to everybody's health and supplements. In this case, for many people, they are in. So take care. Thank you for joining me on Dishing with the Dietitian. I will see you in 3 weeks on October 30th at 7:30 to talk about Halloween. Take care, everybody. Thank you for joining me.